you have left an appointment thinking, ugh, well, that was awful. When you have chronic pain or chronic illness, you may well be seeing some form of care provider, whether that be a doctor or a physio, massage therapist, an acupuncturist, any kind of care provider. Finding the right care provider is not just about convenience, it really can make such a big impact on your entire healing journey and your sense of well-being. But it can be difficult to know whether you have a good care provider or not. If you have someone who's going to work with you or someone who's going to make your journey harder. And so in this video, I just want to give you a few red and green flags to look out for so that you can make a more informed choice when you are choosing a care provider or choosing to stay with your care provider. Hi, I'm Ellen. I've lived with chronic pain and chronic illness, and now that I'm on the other side of it, I won't shut up about it. And I love sharing what worked for me, what's working for my clients, and hopefully I can help some more people along the way. So I do want to say that this isn't about pointing fingers. This isn't about saying like, oh, that person's bad, or that if they don't have all of these green flags, then they're not good. This is just about finding what suits you and having the confidence to listen to your gut. All right. Red flag number 1, they don't listen. If you go into an appointment and the person is just kind of assuming that they know what you're going through, if they're not asking you questions about your particular situation in your life and your experiences, that's a bit of a red flag, because no one's experience is the same, even if you have the same condition. This person may be an expert in their field, but they're not an expert in your life and your personal experience. This can also show up over time. So say for instance, you've been seeing someone for a while and they're starting to get a little blasé. You know, they're starting to not ask for consent when they do something new or they try a new method, and they're not really listening to your cues, say in regards to your pain levels or your pain tolerance. They're just kind of doing the treatment without really taking into consideration your experience of the treatment. Now, that's not to say that they don't care, but it is your responsibility to tell them, hey, this is feeling uncomfortable. Can we try something different? Or can you back off the pressure a little bit? Or, you know, can we not do this? If they listen, perfect, amazing, huge green flag. But if they don't, that is something to consider. I find it especially frustrating when I hear of people who have been through an experience where they say that they didn't want to do something, but the physical therapist or the doctor or whoever it was really tried to convince them and sort of pressured them or manipulated them into doing something that they weren't comfortable with. I would say 9 times out of 10, there's going to be an alternative route. There's going to be something else that they can do to get the same result. You know, I always tailor my treatments and my sessions around what my client feels comfortable with, and constantly communicating with them about what I'm doing and why I'm doing it. So the green flag would be if they're curious, if they're asking a lot of questions, if they want to know your thoughts, your opinions, and your experience. Second red flag to look out for is if they talk about themselves just a little bit too much. Now, this isn't to say a care provider can't share their experience or talk about what they've been through. It can be really helpful. But if you start to feel like you're becoming the therapist, or you're sitting there wondering like, wonder when we're going to talk about me again, that's a bit of a red flag. The care provider is there for you. That's what they're being paid for. That is their job. You are the center of the appointment. So the green flag for this would be if they share what's relevant, but they are bringing the session back to you and focusing on you most of the time. You're not feeling like you're getting dragged into their life story. Red flag number 3. If they're disrespectful or bashing other therapists or other modalities of treatment. So this one has a little bit of nuance. You may want your care provider to weigh in on some of your treatment options. But there's a big difference between being honest and being disrespectful. You know, I've had clients ask me about treatments that I personally wouldn't recommend, and I will give my opinion, but I always preface it with, this was just my experience. If I have experienced it personally, or if I've had clients who've gone through it, I will tell them, look, this is just what I think, but you can always try it for yourself. I really try and be as impartial and impersonal as I can, because what works for one person may not work for another, and what doesn't work for another person may work wonders for another. I think that's the beauty of having so many options, is you do get to experiment, and it is your right to try different things and to be respected when you want to try different things. Maybe besides anything that is truly harmful. You know, I think if you asked me my opinion on bloodletting, I probably wouldn't give a very unbiased answer. So a green flag for that would be simply someone who is open-minded, who is honest but respectful. Red flag number 4, someone who uses inflammatory or sloppy language. Language really matters, especially when you are in pain or when you're sick. Words hit hard. So if you have a practitioner who is using words like broken and misaligned or damaged or just really scary sounding words without explaining what they actually mean, for me, that's a little bit of a red flag of someone who isn't aware of the impact that they can have on their client. So I have a client who has a nerve impingement, which is reducing her ability to use a specific muscle in her leg. And she said that her physio had told her that her muscle was wasting. And I could tell that that word was really playing in her mind. And so I explained to her, while wasting is a technically correct word, it means that the muscle is atrophying, which means that it's just getting smaller, which is a very normal thing. It's the same thing that happens if you don't go to the gym, your muscles atrophy. They get smaller, but they can be built up again. And we knew that once this nerve issue had been resolved, that muscle would switch back on and that muscle would just simply build itself back up again. But I think the word wasting was really playing in her mind, and any sensation that she felt in that part of her leg, she imagined that her muscle was like falling off the bone. That's the impression that I got. And as soon as I explained what the word actually meant and that it wasn't as scary as she was imagining, she felt a lot better and actually felt a lot less stressed about this area of her body. So I think that's a good example of the power of just explaining what words mean and being careful with the language that you use. What sounds perfectly normal and clinical to a care provider or a therapist may sound terrifying and completely unfamiliar to someone who is in pain. So the green flag would be a care provider who is purposeful with their language and someone who makes sure that you understand what they're saying and the meaning behind the words that they're using. They need to walk the line of being medically accurate, but also emotionally sensitive. Red flag number 5 is you simply don't feel safe or comfortable. That can happen. If you're leaving your appointments feeling very tight or feeling like you had to walk on eggshells or mask or pretend, that's a sign that you don't feel safe in that environment and that you are probably being given reasons not to feel safe. Now, I know that some appointments are just inherently unpleasant and you're not going to come out skipping and, jumping over rainbows. But that doesn't mean that you should put up with not feeling safe and comfortable. It's not hard to make someone feel comfortable in their own skin in an appointment. That's my number 1 priority for all of my appointments, is to start with just helping the person feel comfortable. When I met my counselor, I could tell from the very first appointment, I was like, I feel very safe. I feel so comfortable to be myself. I don't feel like I have to pretend or mask. And the more we worked together, the more and more I felt, yep, I can be real with this person. I can be grumpy, I can be angry, I can be a little bit extra, and he is so non-judgmental, and that is exactly what I want for everyone who's working with care providers. So the green flag, someone you can be real with, someone with whom you can be honest and messy and uncertain and feel safe doing so. All right, so some of you might be asking yourself, what if I'm the problem? What if it's me? What if I'm just being too sensitive? And that's a pretty fair question to ask, to be honest, because especially when you have chronic pain or chronic illness, you can feel like you're living on the edge constantly. It can make you feel really raw and really reactive. I remember going into doctors' offices sort of ready to be dismissed and already feeling pretty defensive. And I think sometimes I was maybe a little too harsh. However, having said that, I also had the experience of having someone recognize that I was scared and that I was in pain. And all they needed to do to help me feel better and to help me feel safe was to practice the green flags that I've already talked about. All they had to do was be kind and curious and ask questions, be non-judgmental, to be respectful of the other treatments that I was already trying, and to allow me to be myself even when I wasn't feeling at my best. And that can be really hard, especially for care providers such as GPs. They are pressed for time. I really feel for GPs. I can't imagine how difficult it is to just feel rushed constantly and try and provide care that is kind and compassionate while also just like constantly being on a deadline. That must be so difficult, but they can do it. I've been to good ones and bad ones, and I know the difference. And it doesn't take much. It doesn't take much to be kind and curious. When I finally made the decision to see a specialist about my skin, I went to see an immunologist. I was ready to fight because I had already seen so many doctors, so many alternative health care providers, so many wellness coaches. Honestly, I'd been dicked around that many times that I just felt at the end of my tether. I was tired, I was afraid, I was confused, I was sick, and I was in pain. So I kind of went into that first appointment ready to just be like, fuck you. Particularly because this was definitely the lowest time for me in my health journey. It was the time that I was the sickest and the time that I was the most afraid. And this doctor was the one who was going to prescribe me some pretty serious drugs to get my symptoms under control. So I went in like with fisticuffs. And yes, that probably wasn't the best approach, but that's just where I was at. And thankfully, this doctor was amazing. She answered my questions. That's all it took. I had a lot of questions and she respected me enough to answer them. And I didn't feel silly for asking so many questions. I didn't feel silly for telling her the things that I had already tried. She respected what I was doing. She was kind and respectful. And that's all it took for me to be like, oh, okay, I feel safe. And that appointment went really well. And I did end up taking her advice. But I think if she had been like many of the doctors that I had already seen, who were dismissive and impatient and honestly downright disrespectful, I probably would have walked out of that appointment and just been like, nope, I'm not doing this. I'm not doing this because I don't feel safe. So it works in everybody's favor when a care provider just puts in that little bit of effort. And I don't think that's too much to ask. Which leads me nicely into my next point. What if you have to see this person? You know, there are definitely scenarios where maybe you need to see them for insurance purposes, or maybe you can't get in to see anyone else, or you can't afford to see someone else right now. That's when you just need to practice your own boundaries. And I should talk about that in another video, how to set boundaries and how to make sure that you are being respected. And lastly, you might be asking yourself, what if I have never been to a practitioner like this? What if I have never seen any of these green flags and I can't even imagine what that looks like? That's unfortunately also a pretty common experience. Hopefully this video just helps you imagine what is possible and just gives you some things to look out for to help guide you in the future when you're choosing practitioners or choosing to stay with a practitioner. Because you deserve care that feels like care. And if you're looking for one-on-one support with someone who is going to be collaborative and respectful and supportful, that's not a word, and supportive, and someone who speaks real good, I offer one-on-one counseling sessions online, or if you're in the Sydney area, come see me in my clinic. Thank you so much for watching. I hope you found this helpful, and I will see you in the next one. Bye. Like and subscribe, do the buttons, do the things. Choo, choo, choo.